Hi there, my name is Dr. John Callahan. I'm a pediatrician here at Medical Associates, and today I'm here to speak with you regarding immunizations against COVID-19 for our children and adolescents. I like to think about this first on an individual level. So do the benefits of immunization against COVID-19 outweigh the risks from the vaccine and also overcome the risks of contracting COVID-19 itself and having side effects from the infection? And to me, after reviewing the data and thinking about this for a while, I do come out on the side of strongly endorsing vaccinating your children against COVID-19. While it is true that children have lower risk of severe illness and death from COVID-19 than older individuals and certainly than the elderly, there are still risks involved with this infection for them. I have seen kids who have had relatively severe symptoms, including chest pain and shortness of breath. Thousands of children have been hospitalized across the country with COVID-19, and even hundreds have died. The risks of the vaccine itself are very, very low. Only a few cases they've had severe side effects such as fever, body aches, headaches, and there have been no cases of really severe complications from the vaccine. And it's important to understand that the vaccine is not using the virus itself in any way. It is only using the structures of the virus to induce an immune response in your body. So you cannot get COVID-19 from the vaccine. You're only building up immunity to the virus. So in my mind, the data is clear that we should vaccinate our children who are currently qualified. First, I would have a conversation with your physician on an individual level. I know personally all of the pediatricians at Medical Associates are endorsing having children vaccinated who currently qualify, and that includes their own children. I'd also encourage parents to look at the data themselves and find resources that are reliable that can provide them information. You can visit the CDC website. You can also look at the American Academy of Pediatrics and healthychildren.org, which are great organizations that give data and clear guidance for what parents should consider for their children. So in addition to the individual considerations, which do come out on the side of vaccinating children, there's also the population risk to consider. So as we move into this next phase of the pandemic and hopefully come out on the other side, there is still risk that this virus circulates among those without immunity. Luckily, right now, we have a good degree of natural immunity from people who have been infected before, as well as induced immunity from immunizations. But data has shown strong evidence that immunity from vaccines actually may be more durable and robust than from natural immunity, those who have been infected before. And so even if your child has had COVID-19, it is recommended that they also get the immunization so that they have broader immunity and longer lasting immunity. And that includes against new variants that have popped up, which have been more transmissible and sometimes possibly more virulent or may cause more severe disease. And so by immunizing your child, you're protecting them against these new variants. And it's also decreasing the risk of anyone transmitting this virus and this pandemic from continuing. And with that, we also have to consider the possibility of new variants in the future that may escape our current immunity. The less transmission of this virus we have amongst our population, the less likely that is to recur. and the less likely we enter into a new pandemic in the future, which none of us want.